Hey, welcome back to the Ready State. We are back on the bike, and this one's dedicated to all the boys on the Thick Boy Bike Club. You Circus Bear cycling athletes, you know who you're talking about. Me, Matt Vincent, this is for you. One of the things we talk about, or we see a lot of, is that people talk about, man, my knee hurts on a bike. What's going on with that? And if you ever experience this, let's just appreciate a couple things. One, you're not injured. Your body's telling you some information about the system, right? So let's use that. Hey, I sucked today on the bike. That's information. We want you to appreciate and begin to appreciate that pain is telling you as much about your body as just like you couldn't develop wattage, or you weren't recovered, or you had swelling. These are all just information pieces. So it's not tissue damage. Stop that. But what's going on there? So one of the common culprits for this is as the knee comes around this position, this rectus femoris is crossing the knee and the hip, right? This long strap of the femur. And it's holding the isometric in this position to try to keep the pelvis balanced, et cetera, et cetera. And then I've got to flex the leg. So we see a lot of people monkeying with positions to unload their knee, can't really come forward on the seat because it requires more leg flexion. Got to come back on the seat to see if I can minimize some of that leg flexion. I got to make my seat a little higher, and all of a sudden I'm maybe overreaching because I got to unload the amount of leg flexion and the load on the quadriceps. You can see all the bike fitting nightmares that we go around with this. So a quick diagnostic tool is, well, can I sit and close my legs down? And rarely do we run into someone who can't do this, right? This tells me that the knee is healthy. Every joint in your body should be able to handle overpressure, which means I can take the joint to end range and push on a little bit. That's what this position is, end range flexion. This is a stable, rad position for your knees. This is what we were supposed to do when we were watching the campfire, right? While we're hanging out, making paleo s'mores. But the idea here is we often see that we're only looking at the leg flexion in this flexed short lever position. So what happens when we look at it in long lever position, which means legs straight? So easily, if someone was coming around grabbing my butt or grabbing my heel, they would be able to easily, with the leg in line, knots flying out to the side, be able to bring my heel within about a fist of my glutes, right? And what you're seeing here is, boy, those 30-second intervals I did yesterday, my quadriceps, or 2 days ago, are a little bit stiff. And because when I get to end range here, it's not just effortless, they're pulling through the resistance of the quadriceps. And notice my hip isn't even fully extension, it's a little bit of flexion. So what I'm seeing here is, man, today my quads are stiff. No wonder we love the couch stretch so much here. But I should be able to hold pretty close to that position. When we assess this on people who have knee pain in cycling, their knees get stuck at 90 degrees. Locked. And when I push into it, it's like pushing into a wall. And that wall we know isn't true. How do I know? Well, I just did this. So it's not your joint range of motion. It's some aspect of the tissue system that got stiff because you're developing freakish watts. You, Sparkle Watts, I'm talking to you. And the idea here is, man, you're giving away efficiency in that system. And that inefficiency showed up because some aspect of an over-tensioned position became sensitized. And that's actually the right way to think about it. I don't know why my knee became sensitized. Well, I was poorly recovered, overly stiff, had a few beers last night, didn't sleep, in the middle of social unrest, COVID, existential crisis. It doesn't matter what the mechanism is, it's information. And as we begin to cross things off our list, it's important that you feel safe and are recovered and sleeping well. Of course, it's important that your hydration is important. It's important that your nutrition is good, that your warm up and cool down are good. Also, deal with your stiffness. And sometimes these seemingly very complex problems are less complex than we think. Address stiffness here and see if you can't make yourself feel better. End range isometrics like couch stretch are great, but sometimes you just are stiff. And good old-fashioned soft tissue mobilization, a little focused quadricep work so that we can get your heel closer to your butt is enough to unload the mechanic as your hip is coming around in a circle. Hopefully that doesn't just solve your knee pain, gets you a faster climb and more wattage, which is always the name of the game.